Hi everyone, my name is Ken Frucci and I am the President of Corporate Medical Emergency Training and also the Director of the Dental Services Organization's Dental Compliance Program, as well as Medical Compliance. Our program also extends out to medical facilities besides dental practices and dental services organizations. So some of you guys have actually seen me. I have been out in your offices and I've actually been out doing some of what we call our OSHA inspections and our HIPAA audits. For those of you who have not met, you will be seeing me coming out on a regular basis because part of what we do and our responsibility as a licensed safety training consulting company for dental and healthcare is to be responsible to make sure that all of your medical practices and or dental offices are up to date. And there are certain things that you are required to have in that workplace because the whole purpose of OSHA, if you will, we can put this in layman's terms and just say that employers in the United States are required to maintain a safe working environment for all of their employees. And these days, we all know that we're living in a different world, and it is because of our COVID or our coronavirus. Which is a whole nother issue of why we do what we do because of the respiratory hazards that some of you do actually have in your job duties where you're working, whether it's dental or it's medical. So the idea of what we do is we have a compliance program where we're going to be monitoring all of your practices in your employer. We're going to be responsible for doing the inspections. We're going to make sure that all of your training is done. There'll be certain virtual training that we're doing, and this is one of many. This is actually a Bloodborne Pathogens infection control video lecture. And we keep it pretty simple, pretty short, because all of you have had training like this before. The whole OSHA program can get really, really crazy sometimes. It can get very in-depth. We can take it to a whole nother level, but we don't really need to do that. We just need to make sure that we're able to help you maintain a safe working environment, as well as making sure that you are following your human resources policies and corporate policies into what to do if we have a workplace illness or a workplace accident. So this is your bloodborne pathogen video. This with the other virtual programs that we're going to be doing are going to be implemented into your learning management system. And we're going to be given access to your LMS, and our job as your compliance officer or compliance company is to be monitoring the training, making sure that all required staff that have to have this training are doing it. We're here to coach you. We're here to keep you in compliance and making sure that you're meeting those requirements, as well as issuing all of your approved certifications. So we'll be handling that. Once you do certain training that's going to be required, then we will have access to that learning management system, and we're going to be able to go in and see so-and-so has actually completed certain training, and we're going to be able to issue you those certificates once we've actually verified in the system and the tracking system that you've done your training. So the first thing I do need to mention with the OSHA bloodborne pathogens is many medical and dental offices do not know that you are required to have what's called an exposure control plan. And this is basically, in a sense, your guide to policies that have been set up for you to follow to make sure that you're in compliance with your company and that your company, the employer, is in compliance and keeping you safe. We are developing these manuals for each of your locations. We maintain these manuals. We actually write all the policies for you. We have these manuals documented and maintained, so in the event something happens and you cannot find the manual, we always ask people to keep it in an obvious place because it has to be available for the employees to go and pull out and grab. But we will have it actually on a disk. So anything that we do for you is all recorded and documented. But the big advantage of having this updated plan is when you get the binder, and you're all getting these new binders shipped out to you, you'll be able to start off and see that it'll start off with all of your policies and procedures. You'll notice that you have individual labeled tabs here, which makes it very easy for you to find certain things in the book when you need them. And part of our job is to, and also part of our contract, is to be here for you when there is an emergency situation. So we're going to be your investigating team to follow up and make sure if it's a needle stick, if it's a splashing incident, if it's a COVID incident, we're going to be working hand in hand with your human resources department to make sure that everything is done, all paperwork's been filled out. But in the manual, there is a tab that says forms, and that's where you're going to find the paperwork that you'll need. You'll be required to fill out an incident report form. You may have your own incident report form that Human Resources wants you to use, and that's fine. You don't have to use ours, but it's here in case you need it. And since we're the licensed company that is doing your compliance, we have to include that in your binder. So at least you know you have a backup if for some reason you can't find paperwork. But again, you will call us once you've contacted your supervisor where you're working, and once you've contacted Human Resources to make sure you're following their policies. We're here and you can contact us, and we will work hand in hand with Human Resources to make sure that everything is done. So many people don't think that they need to be followed up medically if they have some type of exposure to maybe a patient's bodily fluids, needle sticks, but with the OSHA standard, and we're interpreting the standard for you, if you were to read the standard and read the state department, health department's policies on that, as well as dental and medical boards, whichever field you're in, you'll notice that it does require that these have to be reported and they have to be documented. And a lot of people fear retaliation from their employer. And I have to stress that OSHA and the Department of Health and all the regulatory agencies out there, and we certainly know more about them now because of COVID. We've got CDC and we've got ADA, and all these different agencies have their hand in it. But they are very strict about preventing retaliation from an employer. So don't let that be an issue for you in reporting it. I know that your employer will work with you. They care about your safety. They definitely have us as a backup to help them kind of educate and enforce to you why this is so important. Certain types of exposures or injuries in the workplace do require outside medical care. And that's where we get into some of the paperwork. When you've heard of what's called the OSHA 300 log and the 301 form, those are forms that your Human Resources Department and your practice managers must complete in the event it's a workplace injury. Because if you have any time from work that's been lost, if you've been injured or you become ill in the workplace and you're out of work, that all needs to be documented on that OSHA log. So, all right, so that's going to be your binder. Let's talk a little bit about certain PPE that I know you guys are all aware of. You've probably heard it over and over, and it can get really redundant. But before I get into the boring part of the PPE, I want to stress the N95 respirators. A lot of medical, dental, unless they're working in a hospital, myself, my former background, I'm a retired New York City paramedic. And when I worked in the EMS system, obviously, as an EMT and a paramedic, we had to wear respirators. And of course, they're wearing them now out in the field because of their job exposure that they have. So a lot of offices don't feel that the N95 mask testing is necessary, but I'm here to tell you that it is. We do know that with the coronavirus, there's been two strains of it, two variances after it reared its ugly head in 2020. We had the Delta virus, now we have the Omicron, and we know that respiratory is an issue for healthcare and dental because they do have potential direct exposure to viruses. Obviously, in dental, you're working in the patient's mouth We know more about aerosol production today that could spread COVID. We know that it's a virus, and we know that it's airborne. So based on that, the very first live training that we're going to be coming out to do, and some of the training that we do for you has to be live, and respiratory protection fit test is one of those. We cannot do that on a computer. We cannot do it virtually. So the N95 respirators, we have two different types of newer design of N95 respirators, and there's two brands that we carry, and they don't look like the traditional round disc shape 3M type respirators. And those respirators are fine, but they have to be fit tested. Just because we put a respirator on doesn't mean that it fits well, and without actually having it tested to see that it's preventing aerosol production or viruses or airborne contaminants from getting in, the idea is to make sure that it is the right mask. So we'll be starting that respiratory protection probably next month. I'll be contacting all the different individual office managers. We'll be coming out. We'll be doing the testing. And we give you respirators when we come out and do the fit testing for you so that you don't have to use the ones that you have in stock. And currently, from what I've been made aware of, is that the Smilist does have a corporate policy where they require that you wear an N95, not the entire day. You should be taking it off in between periods where you don't need to wear it, because it's not really a great thing to wear 8, 9, 10 hours a day. It does affect your breathing somewhat, and it can affect your ratio of oxygen to carbon dioxide. However, when we're treating patients, your employer has requested and basically required and written that you should be wearing an N95 because it really is the best protection. However, for those people who cannot wear an N95, we do have some other options. The KN95 mask. When we also talk about masks, we're talking about the right surgical type of masks. And this particular brand is a brand that we carry that we highly recommend. When the pandemic first came out, I did a lot of comparison on surgical masks, and I found that some masks were made cheaper. They were really very thin. And sometimes when we come into a client to do a respirator fit testing, we'll actually do a little simple water filtration test on the surgical mask that they have. And basically, you don't have to be a scientist to figure this out. It's common sense if you really think about it. But if you put a thinner, cheaper made mask, a surgical mask we're talking about, and if it's a level 1 and it's not at least certified as a level 2, level 3 mask, it is not going to be effective enough in preventing fluid accumulation coming through the mask, as well as any aerosols or any viruses. And when we spray water on the outside of that, the person is wearing it, and then we have them take that surgical mask off, and if it's damp on the inside, it's kind of a no-brainer. It's showing you that it doesn't have a good filtration on it. So that's something else you want to make sure you have, is at least level 2. I know there for a while level 3 masks were very difficult to get. They're not as difficult now. We have a company that we distribute their masks. They are the best out there. They're actually local. Our corporate office is actually based in Bedminster, New Jersey, and we go everywhere, but that's where we're based out of. And this company that we purchase the masks and the respirators from is actually in Pennsylvania. So we don't have any issue getting you the mask, getting you the PPE if you need it. But some of the offices I had been to, they did not have N95 masks on the premises. They only had the KN95. So the respiratory standard clearly does say that we must provide N95 masks for employees who choose to wear them, or if it is a corporate-wide mandate to wear an N95. But again, this is why we have to do the live fit testing. When we come out, we may find that some people cannot wear an N95. And if that is the case and they can't do their job safely, then what happens there is we take a positive and turn it into a negative, And now we violate the OSHA standard because now we expect an employee to perform their job when they can't perform it safely. So we have other options. Some other options for those people would be either a KN95 or possibly switching to a different type of N95. And then considering the fact that if we use the proper level surgical mask, face shields. And I know that you guys are all familiar with the face shields. Since this has all come out, since 2020, the manufacturers are even better at developing better eyewear and hardware that doctors can use, hygienists can use if you need to get deeper into the mouth. And we know that that's primarily what you guys do. So the face shields have become better. They do make some permanent face shields that need to be sterilized. Some of those are an eyeglass frame that has an ability to put the loops on so that you can see into the mouth. Some people have complained the face shields cause a lot of glare and they can't see what they're doing. So we have to determine what works for one person may not work for another. But along with that PPE is just the proper eyewear. And a lot of times people may not be aware that the eyewear they're using may not be a wraparound device. You can see here that these have side shields on them. And if I was working, I'm retired from EMS now. Now I own this company and I teach and I manage this company as an educator. But when I was in the field as an EMT or paramedic, these glasses, and that's still true today, these glasses themselves as prescription eyewear would not meet the minimum standard for eyewear protection because they don't have the side shields. For a long time, people were getting snap-on side shields, and I'm not 100% sure they're really that reliable. I've never used them, but I like to always overemphasize having more PPE and being better protected is always, at the end of the day, the best thing to do. There are people who don't feel and believe that there are exposures or transmissions to the coronavirus or to COVID in a dental office, but I can tell you that it is there. In the past 2 years, we've had clients that have had exposures. Either employees have come into work and they haven't felt well, or they may have been in the office 24 to 48 hours working, and then after that, they end up not feeling well, have symptoms, and then they test positive. You can have patients that may walk in, and we all know the term asymptomatic, what that means. People can be carriers for this and be contagious and not have symptoms. So it brings up the question, how well protected are you? Are you really protected with the proper eyewear? Are you protected with face shields? Do you have everything at your disposal to prevent yourself from any type of spraying, aerosol production? And the next training that we'll be developing for you after this, which will be going into your learning management system, is the hazardous communications training, otherwise known as HazCom or hazardous chemicals. And that also has to do with the same PPE, because when you think about the chemicals that you guys are using, when you're sterilizing instruments, you're cleaning, you're using materials, even in home use today, for public use, people are always exposed to chemicals, spraying and vapors and things of that nature. So there again, we're talking about another type of exposure. So it's not just the patient care and exposures to patients, it could also be through other job duties that we have. And the other issue comes up today as to whether or not you're wearing the proper gloves. Basically, a lot of times when you're doing sterilization, and I have actually never practiced as a dental hygienist or an assistant. I have a medical background, not a dental background, a dental education background, but never practiced. These are the types of gloves that you need to have available. They're required. There is supposed to be a pair of a heavier rubber type glove in the operatory sterilization area. It has to be available for people that may be sterilizing. The issue can come up. We have seen it. It's rare, but we've seen it, In the past 21 and a half years that I've owned this company, I've seen it where some assistants or hygienists can get stuck with a dental instrument. And that instrument could have an infectious agent on it, or what we know as a pathogen. And hence the term bloodborne pathogens, because pathogens are agents or microorganisms that can transmit disease. So if you stick yourself with an instrument and it pokes through the glove, which obviously with a regular non-latex nitrile type glove it very well could, that would be another exposure. And that would be another workplace injury that needs to be followed up on, and it needs to be documented and dealt with properly. I have had, as I said, seen situations where people have actually had dental explorers or tools maybe poked through their glove. And always an interesting question, which I don't always know the answer of because, again, I've never practiced as a hygienist or an assistant, but I've had different people give me their opinions on whether or not they should be scrubbing these instruments. So based on that, it's another job task that you may be doing that could very well expose you to getting stuck with an actual sharps device as well. Another type of PPE, which we consider PPE, but it's really more considered to be what we call a work practice control, which is a safeguarding, because you hear terms known as engineering controls and work practice controls or safe practice controls. And engineering controls has to refer, or it has to do basically with machinery or equipment that you're using to do your daily tasks and your job duties. But the equipment has to be maintained, it has to be sterilized, and it has to be working properly to prevent injuries. And part of that would be a proper sharps disposal container. The sharps disposal containers have to be in each operatory or in each area where you are handling sharps. We just recently had an incident with a client. We have another DSO, dental service organization that we work with, where they do oral surgery. And the oral surgeon was doing anesthesia, was starting an IV and getting ready to put the patient to sleep. And when she withdrew the IV catheter, and I know this way too common in EMS, but in EMS we have new sharps devices that prevent us from getting stuck with those IV catheters. But in the dental industry, they may not be using these new sharps engineering devices. She handed off the IV catheter to an assistant to put in the sharps disposal container, and in the process of that, the assistant dropped the sharps, and it ended up falling straight down towards the floor, and the open end of the needle was exposed, and it actually went into the doctor's foot. So it either went into a sock if she was wearing a sock, or she didn't have socks on, but either way it went into her foot. So when they called me and we handled the exposure and handled the follow-up as part of our compliance, we determined that they probably were not practicing the best engineering controls and work practice controls, because they had to reach over or they had to hand off that sharp. And we really don't want to do that. It's not safe. Some of us are from the old school and we've done that, but we need to sharpen up our skill on that, because that is clearly an actual exposure and that needs to be handled immediately so that there's no liability, and making sure that the patient actually is safe and the employee is safe. So what I have seen sometimes is that the sharps disposal containers are not as close to where the task is that's being performed. And a few offices, kind of some older offices from the old day, they didn't have these lockable lids on them. You can see that when you put the sharps in, it's only one way it's going to go in, and when you twist your carpule or your device to break the sharps, it's in here, and you shouldn't be able to access it and pull it out. And some offices I've been to, they'll have sharps disposal containers where they're wide open, the lid is open, and sometimes we see very small sharps disposal containers and they're getting filled up. And that's certainly an unsafe work practice control and an unsafe engineering control, because people can rub against that sharp and have a potential injury. So when we come in to do your inspections, we use an actual checklist form that allows us to see if you have all of these devices in the office. Anything that we see during our inspections and our audits that needs to be handled immediately, if it requires immediate attention, we make that a priority. We get back with your facilities department and with your HR department, and we work with them to make sure that any major incident that could cause an injury or liability is handled immediately. So these are all the things that you should be doing that I'm pretty sure most of you are. But the big issue is evaluating your PPE. That's what we call a risk assessment. We'll be able to find out if you have jobs that you're doing that maybe another facility is doing something different, or maybe they have a higher level of exposure. We need to identify that right away. So there are actually 2 videos that I also want to make mention to you. One of the nice things about this particular program and a lot of the different virtual classes that we're setting up for you, and companies your size with the number of employees that you have, it works very well to do it virtually and adopt it into a learning management system, because people have different hours, they have different schedules, and so forth. So we don't always have to do a video per se, but YouTube, I will tell you, I have found to be a great source of information. Sometimes there's bad stuff on YouTube and sometimes there's good stuff. But the good stuff, there are 2 different videos out there that help to reemphasize what we're talking about. And it helps to reinforce this lecture that we're doing for you. And one of those is from a company called National Safety Compliance. We used them. We found their videos to work very well. They actually put out a bloodborne pathogen video for a non-healthcare worker. And that's really valuable these days, because with the COVID exposure, anybody working in any corporate environment or any non-healthcare environment where they may have some exposure, employers are required to provide certain PPE. And, people today that are non-healthcare, non-dental certainly know a lot more about what PPE means because of the coronavirus. And that includes surgical masks, that includes respirators, that includes things that maybe where they're working, there is a potential for that. So the National Safety Compliance video is actually on YouTube. You can pull that up. They give you a free demonstration of what the video is. I do have some clients that do not like to do virtual training with us. They request that we come out and do live training. And when we do have the hard copy videos that we put into a DVD player, and we can explain the whole OSHA safety program for them. And then the other one is from a company that is actually called Easy Compliance, and they put out a nice video also, and it's actually a free video, and it actually goes into kind of just the overall OSHA program. So. All right, so those are just 2 other resources for you. So let's talk a little bit about what happens if you have an exposure, and then I want to talk a little bit about vaccinations. So according to the OSHA standard and the State Department of Health, and in every state, we have what's called the Department of Labor. So the Department of Labor is the one responsible. They're a division of OSHA, and they're the ones that are responsible for making sure that employers are providing safe working environments. So here's how the program is supposed to work, and we're here to help you kind of do it step by step, in addition to your HR department. There are some dental companies or healthcare companies too, that might be small enough to where they may not have an actual HR department. You have an HR department corporate-wide, so we want to make sure that you're doing what they ask you to do, and then what we advise you should work well in conjunction with that. So the first thing is you need to wash the affected area, regardless of the type of exposure. If it's an exposure in your eyes, that is a potentially serious situation, which goes back to the eyewear standard. If you are not wearing eyewear, which I would be surprised probably if people aren't when they're doing patient care today. There's a splashing of bodily fluids into the eyes. If you were to be sterilizing an operatory, or you were sterilizing equipment in the sterilization or laboratory area, and there's a chemical that you've used that you've now splashed into your eyes, you need to make sure, and we check this in every office we go into, there has to be an operational eye wash station. You have to know where the eye wash station is. The first aid treatment for any exposure into the eye is to immediately irrigate and flush the eye for 15 to 20 minutes. You may, on some occasions, depending on what it is, may still need to call 911 and have that employee transported to the nearest facility. When it comes to needle sticks or possible COVID exposures or splashing incidents other than the eyes, or even in the face, the mucous membranes, the mouth, most people are more comfortable going to their own physician for a medical follow-up once the paperwork has been done. But you do want to check with your HR department, because they may have a corporate policy where they have someone that they want you to see, or you need to find out if they would let you go to your own physician or the nearest urgent care and urgent medical center emergency room. But eye wash stations are a real problem. And we have been in offices where they do not have an eye wash. And you have to have a sign that goes above the eye wash so that people know where it is, because you don't obviously want to play around in the eyes. That can lead to serious complications if we don't know how to handle it. Most commonly, the eye wash stations are built into the sink. There's also a plumbing line installed where they have water coming in that allows the eye wash solution that's mixed in there. It's usually an isotonic solution that will help absorb chemicals and wash them out of your eyes. It doesn't have to be an eye wash of that nature. The OSHA standard says as long as the eye wash has the availability or the ability to flush the eyes and clear the eyes for 15 to 20 minutes. And I have seen where they may have an eye wash type device installed on the wall that may have bottles that have either saline or an isotonic buffering type solution that's used to neutralize any type of acids or harmful chemicals in the eyes. So that is acceptable, but it is common in most medical and dental to have the ones that are installed into the sink. But again, that needs to be done right away. The other types of exposures can sometimes be delayed a little bit, but we don't like people to wait to the last minute. So the sooner the better. So the paperwork, the exposure incident forms need to be filled out. In the states of New York and New Jersey, where there are dental and medical, and if you're not in New York or New Jersey, you can check with the state Department of Health on this. But currently in the two states where we are at, they require a form must be filled out by the employee as to whether or not they will allow to have their blood tested. It cannot be done verbal. It has to be done written means, documentation. And that form also requires, at least here in New York and New Jersey, that the source individual, which would be, let's say, the patient, and this is if you know the patient. You may know them, you may not, because it could happen after the patient's already had dental treatment. But if you know the patient, you do need to obtain written consent or a written refusal on that form. So when you open our binder, you'll see that form where it requires both signatures, either yes or no, to have the blood tested. They may, when they test your blood, if they do find something, some type of possible traces of an infection or whatever, there really is extremely low transmission. I have to tell you, it's very, very rare. In the 22 years that I've been practicing the dental education risk management, we have never, ever seen a situation where someone has died from an exposure or they've ever had any type of permanent disease as a result of it. I don't know of one case. But sometimes based on the individual's health, their current vaccination status, and current immunology, if you will, of their immune system, they may recommend that employee take some type of antibiotic or prophylaxis. So they may make that recommendation to you. So you can refuse all this if you choose. However, if you work for a corporate-based company, it could be a corporate policy that says you don't have a choice. You have to do this, just like wearing an N95. So I really want you guys, I'm here to help you. I want to give you what the standard says, but I also want to be here to make sure that you are being advised through your corporate HR. We don't want to tell you to do anything that's outside of what your corporate policy is. So I stress that highly, that you need to contact human resources. You need to speak with them and make sure you're following their protocols. They may tell you you don't have a choice. You have to be tested. You're an employee. Or if you don't want to follow their protocol, you can no longer be employed there. So that's in the hands of HR. But there is a refusal form that is actually in the form section where the employee can sign off and say, I refuse any follow-up. I choose not to do this, and I'm going to exclude any of that from my employer. I wouldn't recommend it, but it can legally be done unless you're working at a company where this is mandated. The same is true for vaccinations. You may or may not, if you're getting into the healthcare or the dental industry and you're new and you're getting into it, you may not be able to refuse vaccinations. There is a vaccination declination form as well in there. But again, you need to check with your individual HR policies. I find it interesting, and I don't see it very commonly, but there for a while I saw it, where there were dental and some medical people out practicing where they did not get the full series of the hepatitis B vaccinations. And that can be an issue for two reasons. One, the hepatitis vaccination program is so much more advanced than what it was back in the day. Almost zero side effects from the hepatitis B vaccine. And number two, I would find it interesting because to get into dental assistant school, dental school, medical school, I know when I went into paramedic school, you have to be an EMT first for a while before you can go on to paramedic level. But to get into the paramedic program, if you don't produce an entire sheet of your different vaccines, they won't let you in the program, because you were actually treating real people. When I went to school, I was in school during the AIDS crisis and learning how to start IV on a lot of AIDS patients and a lot of people who maybe had HIV but didn't have AIDS. And we didn't have all this technology for needle sharps prevention. We didn't have technology that prevented needle sticks. We had a very high risk for that. So in school, you have to actually learn how to do it on a real patient with a team of doctors and nurses in a hospital. So obviously, they won't allow a student into a program because of that liability if they can't produce those vaccines. So I just want you guys to be aware that the vaccines are there to help you. We have learned new documentation over the past decade that hepatitis C is no longer a death sentence. You now can be cured from Hep C. If it's caught early, it's treated correctly. I truly believe that if you're up to date with your hepatitis B vaccine and your titers come back as positive for having the antibody to hepatitis B, that provides immunity to your liver that typically some people may not have, and it could very well lower your chances of developing Hep C. We know so much more about hepatitis today than we ever did back in the day. So there is a declination form in there for any new clinical employee that comes on board to work and does the onboarding with your employer through your company. They must have hepatitis B vaccines. And even though there's a declination sheet in there that you could refuse that, you have to offer that to a new clinical worker within 10 days of you hiring them, if their job involves clinical or involves possible exposure to bloodborne pathogens. And when we say possible exposure, I just want to give you very quickly a definition of the two different types of workers. One, we have clinical workers, so we know that they're in the category of exposure. Two, we may have a non-clinical worker who may be strictly administrative, who may only work at the front desk, who may only deal with insurance, they may only deal with the patient's paperwork, and maybe setting up appointments and so forth, and dealing with insurance companies. But if they're ever asked to come into the back to help, it wouldn't be very difficult for someone to say, hey, I need a hand back here. Can you give me a hand, or can you help me clean this operatory? Once they're put into that type of an environment, they are no longer considered non-clinical. They're now clinical because their job tasks that they're asked to do could involve possible exposure. These people must also be offered the hepatitis B vaccine within the 10 days of hiring. Alrighty, but again, please check your HR department on that because I think it's important that you know what that communication is, as well as knowing the communication. Are we required to wear certain PPE? We want to make sure we're giving you the right information and the right documentation. Alrighty, so in a sense, this is basically your bloodborne pathogen program. I don't think it's necessary that we get into the definition of pathogens. You all know what that is. We all know what microorganisms are. We all understand what we need to be doing to protect ourselves, and we all know what we need to do to make sure that we don't prevent an illness or an accident. But anything that involves medical follow-up needs to be documented. Paper cuts in the office, somebody falls and they're fine and there's no major injury. That's not going to require an immediate consultation. It's not going to require an outside medical consultation. The COVID is another area where we want to make sure that you understand what your company-wide policies are. We know more about COVID. We know the Omicron variant is very contagious. So we want to step our game up a little bit and never let our guard down and make sure that we're even better protected. So typically, the way the program is written under OSHA and the State Department of Health with different types of exposures under COVID is that if an employee has any type of potential sign, we live in a world now where runny noses, sore throats, congestion, headaches, any of this now, we need to make sure that we don't come to work with those signs and those symptoms. We need to call out. We should have those employees tested as soon as possible to make sure it is not the coronavirus. There's always a chance that it could be just a simple cold or something else, but because it's respiratory and it's viral, it needs to be tested. If the employee tests positive, then they need to follow the quarantine procedure. Recently, they've just updated the quarantine policy for people that were asymptomatic with no signs and symptoms from 10 days to 5 days. In some cases, people who may still have some signs and symptoms, but they're moderate even after the 5 days, they may be extended to a 10-day quarantine. But we want you to follow your corporate-wide policy on the quarantine. That all needs to be documented. That has to go on the OSHA 300 log because that does show that you've lost time from work. It has to be recorded the number of days that you've lost. An exposure report form needs to be filled out if that employee was in the office working 24 to 48 hours prior to developing these signs and symptoms. If the employee was out in the public and it was a weekend or they were on vacation or whatever, and they were not in the clinical setting within the 24 to 48 hours, then an exposure incident report form doesn't need to be completed. However, the OSHA 300 log and an incident report from your HR, which would basically be a COVID exposure report form, it needs to be documented. Copies of vaccinations. We recommend highly that people provide copies. of their COVID vaccines. We work with some individual medical and dental practices that are privately owned and they don't have an HR department. So these individuals, we work with them and we highly recommend that there are copies of these vaccines in the employee's medical file or the employee file. So please check with your employer's corporate-wide policy on that. They may mandate it, they may not. So you want to check with them. Most of you may know, and if you don't know, that as of November 4th last year, right before the holidays came about, OSHA and every state department of health, and I'm not sure if the dental boards are yet documenting this, they may in the future, you can check with your state dental board, that employers that have 100 or more employees are required to provide free COVID testing. So that would more than likely be the nasal swabs. And these are for companies that may not mandate that the COVID vaccine is mandatory. It may become something in the future, maybe with this new Omicron variant where they're going to mandate it, because some of us do believe, our opinions are that the vaccines make a huge impact for someone who may get this second variant of the Omicron, because you've got immunity and your body would be less resistant to this new strain of COVID. But again, you need to check with your HR department on that. If an employee who has been exposed and has followed the proper procedure, we are always telling people that we think it's the best thing to do is to go and get a negative PCR test. Again, if you have an HR department, check with them. We do believe that a negative PCR test is the best documentation and verification to show that that employee now is free of COVID. The employer, currently the law states, unless this could be a statewide policy in other states, but currently where we are here, there is no law that we know of that says the employer must mandate a negative COVID PCR test before they allow the employee to come back to work. We think that's very good. We think it's highly recommended, but you want to check with your employer's HR department on that, because the employer is eventually still responsible for making sure that that workplace environment where that employee was working is safe and that they don't respread any type of contagious disease. And any employees who were actually treating patients who may have tested positive within the 24 to 48 hour time frame, you need to contact those patients. That is regulatory, that is standard right now, that those patients that employee treated within the 24 to 48 hours should be contacted to make them aware that this employee did test positive for the COVID. And then it's up to those patients if they want to go get a COVID test. The home test, I don't know a lot about them, and I'm really not an authority on that. I know they're a good baseline, but there have been a lot of studies, and there have been people who are not sure that a home COVID test is really as clear or as thorough as it should be to be used to determine can that employee come back to the workplace. So again, we want you to check with your HR department. I know they have policies that are set up on that. I'm sure they have a company-wide policy, and it's our job to make sure that you guys are all aware of that and to make sure that all the offices are getting the same communication and the same up-to-date information, and that we're all on the same page, because at the end of the day, it's about safety. And the only other last possible exposure would be if you had a patient who you had treated and it had been 24 to 48 hours since they were treated by you. If they call you to tell you that they think you should know that this patient has tested positive for COVID, all the employees who were working on this patient, they all need to be offered the COVID test. That is required by the employer, because again, we have to keep the workplace safe. Alrighty, so that's basically it for your bloodborne pathogens and COVID. The next thing that we'll be doing as far as your training is rolling out the next virtual program, which will be a small lecture on your hazardous communications and your hazardous chemicals. And we will, within probably the next day or two, start scheduling the live respiratory protection fit test that we have to come in and physically do. So you guys will all be attending that. We will be producing certificates for you and training records to show that your employer is compliant with this and that you're compliant. And we hope that the benefit of that respirator fit mask testing is to reinstore your confidence that your employer does provide the proper PPE and the training, as well as that it's a safe environment to return to work. So, and until that point, anyone who completes the bloodborne pathogens or any virtual training with us, make sure that you document in your learning management system that you have completed it. We will be reviewing your LMS every week on a regular basis to see those individuals who need to be reminded to take this training because it is mandated, and to make sure that we know that we're issuing all those certificates, as well as your continuing education credits to all those people. So, all right, so I thank you for your attention. We'll be seeing you guys again soon. If there's any concerns or questions, please do not hesitate to call me. My direct number at our corporate office is 917-439-7338. And my direct email is kf1104@icloud.com. Thank you very much, guys. We'll see you soon, and please stay safe.